The current system is so corrupt, it is so one-sided, that the doctor has become completely marginalized in the entire process of healthcare. What doctors want is they want to be doctors. They want to treat people. They want to help people get better. They want to help people get well. The future of healthcare is not going to be where we fix insurance-based care. It's going to be where the practitioner is empowered, the physician is empowered, and then they work with the patient to empower and release the patient. So help us save healthcare. I want to talk to you today about a concept called the empowered practitioner or the empowered physician. We believe that physicians should be empowered to be able to have the conversations they want with their patients. We also believe that empowered physicians, practitioners, lead to empowered patients. So let me explain. At the time of this recording, there's a big hubbub in Washington, D.C. as to whether or not Bobby Kennedy should be heading up our health in America. And I believe he should. And the reason why I believe he should is the current system doesn't allow for physicians to have empowerment with their patients. The current system is so corrupt, it is so one-sided, that the doctor has become completely marginalized in the entire process of healthcare. Now, healthcare is an important component for any industrialized, wealthy nation. And the facts are very clear. Hey, I'm Matthew Galogli, and I'm a maverick. Well, what is a maverick? A maverick goes against the grain. We find our own way. And if you're sick and tired of being pushed around by the insurance companies, come join us. We'll show you the way out. And you'll love medicine again. Our health system in America is hurting our society. Do you know that here are some basic statistics for you. America spends significantly more per capita per citizen than any other country in the world. We spend, I believe, somewhere in the neighborhood just shy of $15,000 per citizen in the United States for our healthcare. Other countries spend $9,000, $6,000, okay? Now, here's what's fascinating about this. Not only do we spend the most, but we get the worst outcome. We rank 48th in outcomes. So why is that? Well, there's a lot of reasons as to why that is. But what the biggest challenge, I believe, is that they keep practitioners, physicians, so busy seeing patients that physicians don't have any time to really learn what is going to benefit the patient. If you're seeing 60 patients in a day and you're doing that 4 or 5 days a week, there's a pretty good chance that you're exhausted at the end of the day and you spend your weekend charting and doing notes so that you don't get in trouble or you don't get sued. So when are you going to have time to be able to grow and expand? Well, you don't. And so what happens is you are dependent upon other people telling you what it should be. The reality is the doctors should be the one that are doing the research. The doctors should be the ones that are testing new ideas. Doctors are scientists at their core. And so science is really all about what? Questioning, right? When you're a scientist, you always go, well, how could this be better? Or is that really true? Or let's make sure that that's really true. When you're so busy and you don't have time because all you're doing is seeing patients and writing notes, what has to happen? Well, you've got to believe and rely on the information of other people, and you don't really have a chance to double check it. The same thing goes with the empowered patients. Patients are basically coming to you for answers, and they're frustrated because they're not getting them. All they do is they get a scalpel or they get a prescription pad. And so they're really unable to really have that empowerment. So what do we do here at Mavericks? Well, what we do is we advocate for you, the physician. We believe that you shouldn't see 60 patients in a day. In fact, you shouldn't even see 40. In fact, maybe you should see 60 in a month. Think about that. What would it be like to see 60 patients in a month? What would it be like to be able to spend 20 to 30 minutes with a patient and really dive into their situation, dive into their nutrition, dive into their hormones, dive into what's really hurting them, dive into what medications they're taking, and really take a look at everything and really get the results that you want. Because I talk to doctors all over the world, and it's not just here in the United States. It's not just in Canada. It's all over the world. And what doctors want is they want to be doctors. They want to treat people. They want to help people get better. They want to help people get well. So we advocate that you can become an empowered practitioner, empowered physician. So how do you do that? Well, that allows you to deliver high quality care. And so you can't do it within the confines of insurance. The economic model just will never allow you to be able to spend time with the patient and still survive. So what do you do? Well, let's say you own your own practice. What I would highly recommend is that you get a copy of our book, The Anatomy of a Seven-Figure Medical Practice. It'll detail out how to start and add cash services to your practice. Or watch more of these videos or listen more to our podcast. And we're going to have a lot more podcasts, longer episodes coming out. But I really want you to understand the future of healthcare is not going to be where we fix insurance-based care. It's going to be where the practitioner is empowered, the physician is empowered, and then they work with the patient to empower and release the patient. You're going to be able to give much better high-quality care. Now, if you're working in a hospital where we talk to a lot of you and you've had it, they're getting ready to renegotiate your contract, they're changing your RVUs, you're not going to be making as much, they're asking more of your time, and you're really thinking about getting out. Then get the book. Come to one of our conferences. Talk to us at one of the events that we speak at. Let us work with you to show you how you can get free. You can be like Dr. Eisenberg, who is working for a large orthopedic group, and he has a side hustle where he's growing a regenerative practice, and he's doing $50,000 to $60,000 a month, seeing patients 1 or 2 days a month. Yeah, you can do it. Believe me, you can do it. We have the roadmap and we have the path for you. So look, check us out. All right. I hope you enjoyed this video. Leave your comments below. But we want to help you get free. We want to save healthcare in America, and the doctors are going to be the ones that save it. So help us save healthcare. Let's show you a new path and a new way to freedom so that you can be a doctor again. I'm Matthew Galogli with Mavrix Profit System, known as the Chief Maverick in our company, and I'm also the founder. You have a great day. Thanks.